that we have got. Now, there are certain gaps. A CP child gradually develops a delay in achieving development milestones, and each delay means that the next interrelated development will be more delayed, and thus the gap between the normal child and the special need child increases with age. Now, if you have an untreated child, that's the lowest curve. If you give standard therapy, we can jack it up. HBOT plus standard therapy, we can jack it up further. Now, some difference will still remain, but it need not be as wide as this. So we can definitely give an improvement in the quality of life of the child and the family with maintained intense one-to-one standard therapy supplemented by hyperbaric therapy as per the Hart's protocol. Now, why is this happening? Now, this is just theory, because we need biological markers, as Dr. Jain said, but this is just one theory which I have picked up, that the motor neurons are an undivided single strand from the brain going down to the lower motor spine, and they all bunch together into a dense telephone cable at the internal capsule. There, the inflammatory anoxic tissue edema can compress the nerve tracts to reduce transmission rate, besides the injuries which are there at the cortical level. So when we are using oxygen 100%, which is vasoconstrictive, are we reducing the edema at the internal capsule to facilitate the capillaries opening up and a greater perfusion, which is why the motor, as I showed you, is slightly better with 1.5 and 100% oxygen, and it is less with air and hyperbaric therapy at 1.3? Maybe. But we need more inflammatory markers, superoxide dismutase and all that studies, which we have not done, but we would like to do, because every visit to this conference has been a learning experience, and this is something that Dr. Jain opened up my eyes to. We will be following this up to study the biomarkers of inflammation and edema to see what's exactly happening and why is it that about 10 to 15% of the kids don't respond. I don't have the answer yet. We will have in the future. But if you look at the cognitive pathways, now that's a different, it's a wide area network. Every single sense that we have, touch, pain, temperature, everything, hearing, our emotions, our memory, everything has to work in coordination in order to develop cognitive. So there are many centers plus many endocrine systems interact to give us the final result of intellect, memory response, psychosocial behavior, alertness, attentiveness, everything. And each center has to simultaneously work at optimum levels to give us the best output. If we have vasoconstriction mediated anti-inflammatory effect on the injured areas, great. But if the same vasoconstriction is going to depress the normal areas, that's not so great. Is that the reason why 1.3 gave us the best data for cognitive? I don't have the answer yet. It needs biomarkers to prove. This is my theory, that possibly, I have no proof yet, but this is the feeling I'm getting, that possibly the wide area network needs everybody to work in consort. We are evolutionarily used to a certain oxygen to carbon dioxide ratio, which we jack up with 1.3. So we have got greater oxygen delivery, but at the same time the carbon dioxide is there to ensure that there is no undue vasoconstriction. Maybe I'm saying, that is the reason that cognitive wide area network is appearing slightly better. And if we can have the Pierre slide, please, excuse me, the Pierre data, the PDF file, this is the original Lancet paper. And here also you will find that if you go through that original paper, Pierre also got a slightly better non-significant change with the 1.3 group over the 1.75 group. So our data has not changed. What the McGill University reported almost 10 years ago is exactly what we are still finding. That with hyperbaric air at 1.3, the cognitive is slightly non-significantly better. So where are we? There are questions to be answered. I don't have all the answers. Hopefully we'll have more answers in future. Can we go back, please? So motor pathways are a single non-relaying pyramidal track that forms the internal capsules, whereas paths for memory, cognitive, etc. are dependent upon complex, oxygen-dependent, multiple interconnecting pathways with interlinked multi-regional neural functions regulated by many neuroendocrine systems, some of which may lie in non-injured areas. theoretically, that's what I feel, but I don't have proof yet. These areas could have got affected by the vasoconstriction induced by the imbalance of oxygen to carbon dioxide ratio. We got thinking about it after the talk by Whitaker at the last symposium, which might not happen to such a degree in a mild hyperbaric chamber where room air with 21% oxygen is used, to which our body has adapted evolutionarily. And even the landmark McGill University study has the same data, though it's not been pointed out in detail. Neither the authors nor anybody else has picked it up so much. Why the slightly better trend for cognitive with 1.3? Now, human physiology has limits. We do not work in extremes. Bigger is not always better. Nature needs a very mild touch. Look, if a fever is there at 105 degrees Fahrenheit, you only need a 6% reduction. A diastolic BP of 110 only requires a 20% decrease. And high acidosis due to lung conditions of pH 7 just needs a 5% increase and you're back to normal. Body works within very narrow physiological limits. If we can restore that narrow physiological change, nature does the rest. So we should not think that we are working alone. We are working hand in hand with nature. We have to find out what is the degree of human involvement required, the minimum, optimum human intervention required for nature to take over and do the rest. Now this is subject to more studies and we will be doing it. And if you look at the study by Wassmann et al. From Germany, who compared in an oxygenated atmosphere the various pressure effects, he found that the intracranial blood pressure, the cerebral blood flow, the lactate levels and the alpha waves, the best is 1.3 to 1.7. This is the window of opportunity. With 1.5 just slightly better. So we have also chosen these three pressures to be compared to standard therapy to see what happens if. So standard therapy is no treatment, this is treatment. So what if we don't treat? That's the gold standard. That's what should happen with standard therapy. And with addition of HBOT, what do we get? We have chosen these three pressures. So what's the placebo effect? So much is said about placebo. Now in our series, the mental age is about 2 to 3 years old. Does your 2 to 3 year old normal child have so much intellect that he can understand placebo? Come on, give me a break. Now you give an adult patient. An adult patient given a placebo has a participation effect, but it wears off in 2, 3, 4 months. I have got 6 to 8 months of data. Where is the placebo effect? Even if the child can understand at 6 to 8 months. Hyperbaric does make a difference. Participation effect cannot last 6 to 8 months. That's what I'm trying to say. Hyperbaric does make a difference.